What is demand oxygen therapy? Have you ever wondered how supplemental oxygen can be delivered in a more efficient way? Let's talk about demand oxygen therapy and how it fits into the world of sleep apnea treatments. Demand oxygen therapy is a method that provides oxygen only when a person inhales. This means that instead of a constant flow, oxygen is delivered on demand, making it a more comfortable option for some patients. In the context of sleep apnea, particularly obstructive sleep apnea, this therapy can be an alternative or an addition to other treatments like continuous positive airway pressure. Sleep apnea causes interruptions in breathing during sleep, which can lead to low blood oxygen levels. This is known as hypoxemia. Demand oxygen therapy aims to raise those oxygen levels during sleep, helping to minimize the harmful effects of these drops. Let's break it down further. Sleep apnea involves repeated airway obstruction or pauses in breathing, causing oxygen levels to fall. Supplemental oxygen therapy provides that extra oxygen needed to maintain healthier levels in the blood. Demand oxygen therapy is more efficient because it only delivers oxygen during inhalation. This can help conserve the oxygen supply and improve comfort for the user. For patients who cannot tolerate continuous positive airway pressure, demand oxygen therapy can be beneficial. It can help reduce the severity of low oxygen levels during sleep. However, it is important to note that while this therapy raises blood oxygen levels, it does not address the airway obstruction itself. Studies have shown that oxygen therapy may not reduce the number of apnea or hypopnea events, and in some cases, it can even prolong their duration. Demand oxygen devices are often portable, making them suitable for home use. This accessibility is great for long-term management in selected patients. However, it is essential to monitor patients carefully, as this therapy does not eliminate airway collapse and may not reduce the frequency of apnea events. In summary, demand oxygen therapy is a targeted way to provide supplemental oxygen during inhalation. It can help manage low oxygen levels in sleep apnea patients, especially when standard treatments are not suitable. However, it is not a replacement for treatments that address the airway obstruction causing sleep apnea.